Welcome back at 8:14. The recent approval of a new epinephrine nasal spray gives patients a powerful new way to keep life-threatening allergic reactions at bay. But this does not mean people no longer have to worry about anaphylaxis. Dr. Reena Mehta with Uptown Allergy and Asthma joins us to explain how this spray works. Dr. Mehta, good morning.
Good morning.
So you were here a few weeks ago and you talked about this spray just having gotten FDA approval, correct?
Yes.
So what's the update now with the spray?
Okay, so this new nasal spray is epinephrine. So it's similar to your epinephrine auto-injector, your EpiPen, but it's a nasal spray instead. It's called neffy, and it's FDA approved for weight 66 pounds and higher. So it's not yet approved for our littles, but the studies have shown that it is as efficacious as your EpiPen. And so for people who are scared of needles, or if you're scared you're going to hurt your child during a medical emergency, at least now you have another option. So now the update is it is approved and it is available in pharmacies.
So normally the EpiPen is what, one injection, or is it two?
It's usually a pack of two. So you start with one injection, and then, within a few minutes, if you notice that the symptoms aren't getting better, you have another one to use. Same thing with neffy.
Okay.
There are two nasal sprays in one carton. So you use one, and then you wait 5 minutes, and if you find that the symptoms are not improving, then you use your other one, and then again, if you feel like, you need to go get emergency attention, then you go to the ER.
And you typically should still go to the ER after you use these, correct?
Absolutely. So now we're just using basically neffy as an option that's interchangeable with your EpiPen. And I think the important point is that epinephrine is the treatment of choice for anaphylaxis. So anaphylaxis is a severe allergic reaction. But what most people don't understand or maybe don't realize is that if you just have hives and vomiting, that's anaphylaxis. So, not minimizing your symptoms, you may say, oh, I'm just going to take some Benadryl. But the problem is, if you delay administration of epinephrine, then that could lead to bad outcomes.
So we need to take one of these two measures and go to the hospital or to the ER immediately for further monitoring, what have you. You also wanted to remind people about Halloween coming up, and everyone's really excited, trick-or-treating, but this is the time of year when accidents definitely happen because we're eating all kind of snacks at school that you don't normally eat, and kids are trick-or-treating and not eating stuff that parents are necessarily able to monitor as much as they'd want to.
That's absolutely correct. This is so timely to talk about this, and it's also a reminder to parents that, again, epinephrine is your first choice. And so if your child accidentally gets into something and then starts complaining, oh, my throat is tickling or my throat is hurting, that is reason to go ahead and use either the EpiPen or the neffy nasal spray and not delay treatment.
So have that with you while you're trick-or-treating.
That's absolutely correct. It's always good to have your emergency bag kit with you that has your EpiPen. If you have asthma, that has your inhaler with you, because we were just talking about how the wind is kicking up all of these pollen and allergens, and also having your Benadryl or your Zyrtec or something like that too.
And I know the teal pumpkin, something that families should be on the lookout for while trick-or-treating. Talk about that whole idea, if you will.
Okay, great. So, there's obviously food allergy is not an uncommon thing. A lot of kids and a lot of people have food allergies. And so if you are a family with food allergies, one thing you can do to show that your house is safe and you are not giving allergenic candies or allergenic foods out is put a teal pumpkin. So for families that are trick-or-treating, they know that if they see a teal pumpkin outside of someone's house, they know that that is a safe place for them to be able to trick-or-treat so that their child gets allergy-free and safe candies.
But still monitor what they're consuming and keep the EpiPen or the spray with you on hand.
Exactly.
All right, Dr. Mehta, as always, we appreciate your time. Thank you so much
for having me.